Today, we're giving you a closer look at the opioid epidemic's impact on your community.
Some of the most devastating impacts from illegal drugs involve children, whether it's a newborn experiencing symptoms of withdrawal or a child killed by fentanyl exposure.
The number of kids in the foster care system affected by drug use is going down slightly, but that might not tell the whole story.
They're definitely affected in a very negative way, and a lot of times the cycle just continues.
Olivia Eichert considers herself lucky. More than 10 years ago, she held 2 titles, mother and drug addict.
Our kids will not get us sober either. I've loved my children.
Eichert wasn't born into a cycle of addiction. After she started using drugs, her family took her kids, caring for them while she got clean. But that's not the case for a lot of addicts.
A lot of these women, their children are going into the system, into foster care, or the kids are being left with the grandparents, and a lot of times they use, so the children aren't necessarily in a better environment.
According to the State Department of Human Resources, the number of children in the foster care system slightly dipped over the past 3 years. In 2018, more than 3,800 kids were in the system. Nearly 46% of those kids had a parent with a substance abuse issue. Just last year, in 2020, more than 3,300 kids were in the system. About 44% of kids had a parent with a substance abuse issue. The number of child abuse and neglect cases reported also decreased last year. There were more than 26,000 reports in 2020, down about 2,000 from 2019. DHR says the coronavirus pandemic caused a lot of kids to stay at home, away from schools, and people outside their household who could report abuse and neglect if children don't themselves. DHR also keeps a record of children who test positive for substances at birth. Those figures vary over the past 3 years. Huntsville Hospital pediatrician Stephanie Israel says she hasn't noticed a major spike in Huntsville, but the hospital will drug test every expecting mother that comes in.
They're affected by this. They're dependent on it because their mothers were dependent on it.
But not every mother who tests positive for drugs is reported to DHR.
It really depends on what the mom's story is.
Israel says mothers may be prescribed drugs that help with their addiction like Suboxone, and it's completely legal. But if there are concerns, DHR will get involved. Israel says she never judges a mother. She knows recovery can be long and a hard journey for both the mom and the baby.
We're really trying to focus on keeping mothers and babies together in the room, really increasing what we call non-pharmacological management. So that means management without drugs.
She has found by treating every mom with respect and encouragement, some choose to change.
Where we have this little glimmer, we can take this moment where we can make a difference. Let's make a change. Let's get you into a treatment program. Let's get you to the right place where you need to be. Sometimes we can flip a switch and make things better.
For many mothers dealing with addiction, the decision to flip that switch comes with one goal in mind: being reunited with their children. For Eichert, she's thankful her sobriety did just that.
My kids are doing very well. The blessings with my family, those relationships have all been restored. I could just go on and on about the blessings of, just getting sober and doing the work.
Eichert now runs a recovery center in Florence. She takes pride in helping other mothers reunite with their kids. She says it's important they break the cycle of addiction and provide a drug-free life for those children. If you yourself are a mother struggling with a drug addiction or drug abuse problem, you have help. Help is available. We have representatives actually right now from Partnership for a Drug-Free Community here with us to answer your questions. And joining us is Luke Hydash. He's there as they answer the phones. Luke, what can you tell us?
Megan, hello. Well, hey, the phone lines are open here in the conference room if you or somebody you know needs help. And joining us now here, Carl Wilkerson. He's the Director of Recovery Services at Partnership for a Drug-Free Community. Carl, if somebody's a little worried about calling in, what can they expect if they or somebody they know needs help when they call in here?
Yeah. Well, it's a simple phone call. The only thing the individual has to do is basically give us a call. We're going to get basic information from them relative to if they're dealing with a substance use issue or if they have a family member that's dealing with a substance use issue. If they do and they're wishing to have services completed with us, then the only thing that we need from them is their basic info, phone number, valid email address, and then they'll be patched to either our office coordinator or our peer support specialist to have an appointment scheduled.
And in that appointment, briefly, what exactly will you be going over and how can you help these people?
We're basically just going to try to assess how severe the situation is. Usually takes about an hour and a half. And after that hour and a half is over, we're going to have a discussion as to about what kind of services are most applicable to meet their needs.
Excellent, Carl. Thank you very much. And if you or somebody you know needs help, the phone lines are open, 256-533-8609. For now, reporting live, Luke Hydash, WAAY 31 News.
Weather.